Soft Skills in Healthcare, created by Khushpreet Kaur Brar, Dr. Lucas, Miss Chloe, Ms. Olivia, Ms. Gina, Mr. Liam, Dr. Wilson. Let's observe how they treat their patients. In healthcare, patients don't just need treatment, they need trust, reassurance, and understanding. In this story, we follow Dr. Lucas, a dedicated physician, as he supports Olivia, a first-time patient who's nervous about her procedure. Through clear communication and emotional presence, he shows how soft skills can change a patient's entire experience. Let's see how it works.
Good morning, Olivia. I'm Dr. Lucas. I'll be overseeing your procedure today. How are you feeling?
Honestly, pretty nervous.
That's perfectly okay. Let's talk about it. You're not alone in this.
I've never had anything like this done before. I keep thinking about what could go wrong.
I understand. This is unfamiliar territory and it's natural to worry. I appreciate you being honest with me. A lot of patients feel the same way. Even just saying it out loud can help reduce the stress. You're doing everything right.
Thanks. I just don't like not being in control.
That makes sense. Want me to walk you through exactly what will happen? First, we'll check your vitals and administer a mild sedative. You'll be awake but relaxed. The procedure itself only takes about 15 minutes.
So I'll feel what's happening.
You might feel some pressure, but no pain. And if at any point you feel uncomfortable, I'll stop and adjust. You're in charge too. We've done this procedure hundreds of times. You're in a safe, controlled environment, and I'll be there the whole time.
That actually helps a lot.
You've already shown courage by showing up today. That's a big deal. I promise to guide you through every step.
I'm glad you're the one doing this.
People usually say the worst part is the waiting. Once we start, many say, that was it. One patient told me she felt like she just blinked.
Well, let's hope I'm that lucky.
I'll be monitoring everything and checking in with you. You'll never be left alone.
That's actually what I was most worried about.
We're a team today. Let's take it one step at a time. I'm going to step out for a moment while the nurse gets your vitals. Then I'll be right back to begin.
Okay, thank you, Dr. Lucas, for talking with me.
You're welcome, Olivia. You've got this.
What made this experience different for Olivia wasn't just the medical care, it was how she was treated as a person. Dr. Lucas didn't just focus on the procedure, he focused on the fear, the questions, and the emotions. That's what soft skills are all about: empathy, active listening, and clear communication. When healthcare providers show they care beyond the chart, they turn anxiety into calm and a visit into healing. Nurse Gina enters while Dr. Lucas steps out. Olivia is visibly more relaxed now.
Hi, Olivia. I'm Nurse Jenna. I'll be checking your vitals real quick before Dr. Lucas comes back in.
Hi, Nurse Jenna. Sure, please go ahead and thanks to Dr. Lucas. Because of him, I am not feeling nervous anymore. I feel a lot better after having a talk with Dr. Lucas. Please go ahead and do your job.
He's a good one. We always hear from patients how calm he makes them feel. You're in excellent hands.
Nurse Gina gently checks blood pressure and heart rate. Olivia sits still, breathing slowly, and Nurse Gina leaves the room after vitals. Dr. Lucas is still out. Olivia is left alone for a moment, thinking.
I didn't think a few kind words could make such a difference. Just hearing someone say it's okay to be nervous, it helped more than I expected. She looks at her hands, still but no longer shaking. I feel ready, or at least not terrified.
Dr. Lucas re-enters with a calm demeanor.
Vitals look good. Thank you for cooperating so calmly, Olivia.
I truly appreciate your detailed explanation. I've never encountered a doctor who took the time to clarify things so thoroughly, making it all so much easier to understand.
It's always worth it. You deserve to feel safe and informed every step of the way. Now that we've talked everything through, I'll go over the consent form with you again, just to make sure you feel 100% clear.
Please, I really appreciate you doing that.
They review it slowly. Dr. Lucas points out key parts, pauses for questions, and encourages Olivia to speak up.
Everything here is your choice. You're always allowed to ask, change your mind, or stop if something feels wrong.
I'm ready now. Not just physically, mentally too.
A surgical tech enters the room.
Hi, Olivia. I'll be helping during your procedure today. Just wanted to introduce myself. I am your surgical tech, Liam.
Nice to meet you.
We work together every day. You're in good hands all around.
We'll be watching your comfort just as much as your vital signs.
We work together every day. You're in good hands all around.
Olivia is sitting upright on the bed, prepared, gown on, monitors ready.
I'm ready, doctor.
You're stronger than you think.
In this longer moment of care, we saw something deeper than medicine. We saw a doctor choose to pause, to listen, to teach, to connect. We saw a patient go from fearful to empowered. And all it took was time, patience, and care. This is the kind of healthcare that leaves a lasting mark, not just on charts, but on hearts. When we treat people like people, when we listen before we act, healing truly begins. Let this story be a reminder. Behind every procedure, there's a person, and it takes more than medicine to care for them. But not every patient experience feels safe, supported, or seen. Let's take a moment to imagine how the same situation, the same patient, the same procedure could feel completely different in the wrong hands. Now meet Dr. Stone. His approach is fast, clinical, and cold. Watch how a lack of empathy, communication, and presence can turn a vulnerable moment into a damaging one.
All right, Olivia, let's get this over with. I'll be doing your procedure today. You've signed the forms, right?
Yes, but I had a few questions.
It's routine. We do this all the time. Nothing to worry about. We're running a bit behind, so we'll get started soon.
I'm just kinda nervous.
I've never had anything like this before.
Everyone gets nervous. Just breathe or something. It's not a big deal.
I thought I'd get a little more explanation.
We already gave you the pamphlet. You'll be numbed and we'll do the procedure. It'll be over before you know it.
Same room, same patient, same procedure, but this time, no eye contact, no reassurance, no listening. Just a checklist, just a clock. In this situation, Dr. Wilson treated Olivia like a task. He may be efficient, but he was disconnected. And Olivia, she felt more anxious than ever. This is why soft skills matter, because when patients feel ignored, rushed, or invalidated, their trust crumbles, even before the procedure begins. Healthcare isn't just about what we do, it's about how we do it.
By the end of this video, you should be able to acknowledge what soft skills mean in healthcare field, why soft skills matters, how it impacts the patient, the right way to treat patients, the wrong way, how not to treat patients. Thank you for watching.